In this video, we're going to talk about your CardioMEMS sensor. Your sensor is permanently implanted inside your pulmonary artery. You will not feel it, and it will not interfere with your activities or daily living. The sensor will not interfere with other devices that you have, such as a pacemaker, a defibrillator, or your cell phone. As you recover from your implant procedure, it is important that you follow your doctor's instructions, which can include reporting any redness, swelling, or drainage from the insertion site. Walk, exercise, and bathe according to your doctor's instructions, and contact them if you develop a fever that does not go away in a couple of days. Ask your doctor any questions about your device, about heart failure, your medications, and review the discharge instructions that you've received following your procedure. There may be activity and, very importantly, lifting restrictions. If you have any questions, please call your doctor.